Now we're going to demonstrate catheter care. With catheter care, you'll be expected to perform both male and female catheter care as part of the same skill. So I will start with female catheter care, and then during the second portion of this video, we'll do the male catheter care. So I perform my beginning 5, and I've brought my supplies into the room. I have my basin with the warm water. I have my soap. I have a linen bag. I have a bed protector. I have my washcloths and my towels and my gloves. What I'm going to do is I'm going to raise the bed to a comfortable working height. Mrs. Day, I'm going to help you with your catheter care today. I'm going to make sure that I have my supplies close by. Pull my linens back. Place my linen bag at the end of the bed. And apply my gloves. Again, I'm going to use a towel for privacy. And I'm going to place a bed protector on the bed. Oops, excuse me. Keeping my patient covered the entire time. When you do catheter care, you need to constantly be thinking about where the catheter tubing is, making sure that you're not pulling on the catheter care. So when you turn your patient, make sure there is enough slack in the tubing to turn your patient so that you're not pulling on that. I'm going to expose the area that I'm working with. I'm going to get my washcloth wet and apply soap. Again, I'm going to start at the urinary meatus using my thumb and my forefinger. I'm going to separate the labia. I'm going to start right at the urinary meatus. Now with catheter care, I'm going to advance this washcloth. I'm going to use my same thumb and forefinger to anchor the catheter tubing so that I don't accidentally pull on it too hard or it becomes out of the patient's body. And I'm going to come down about 4 to 6 inches down the tubing. I'm going to advance my washcloth again and go down the labia and the other side. Making sure that I always put the washcloth back in the linen bag. Got my soap. I'm going to go down the inner thighs here as well, just like very similar to pericare. I'm going to rinse in the same motion, again starting at the urinary meatus, using my thumb and forefinger to separate labia. I'll wash the urinary meatus. I'm going to anchor the tubing, come 4 to 6 inches down the tubing, advance the washcloth, go down labia, other side, again rinsing into the groin area, making sure also that you get the upper thighs. While I do this, I'm going to be observing the area for any crusting or bleeding that may occur, any redness at the insertion site. Also with catheter care, I need to make sure that the patient has a leg strap on per facility policy and that there aren't any kinks in the tubing. I'm going to finish up by drying the area. Again, using the same motions. And then recovering my patient.